Good evening. Thank you for joining tonight's Community Town Hall. My name is Lindsay. I work in Southlake's Corporate Communications Department, and I will be your moderator this evening. If you have any questions, please feel free to write them into the Q&A chat, and we will answer as many as we can during the hour during the question and answer period after the presentation. And with that, I will give you Arden.
Good evening, everybody. My name is Arden Crystal, and I'm the president and CEO of Southlake. And I'm really pleased to be here with you tonight. I wish I could be here in person, and my true hope is that very soon we'll be able to start hosting in-person town halls once again. It's hard to believe that 2 years has passed since we admitted our first patient with COVID-19, and we thought that it would be a good idea to have a virtual community town hall, not only to share some reflections over the last 2 years, and how we've been coping, but also to talk about the future, because one of the things that gets you through very difficult times like this is hope, and we have some hope, and we want to talk to you about that. But first, a few reflections. So just to start with, those first few months of the pandemic were really frantic. We quickly assembled new teams, we learned new skills, we refreshed old ones, we pivoted every day as new information about the virus came out. And as a hospital, everyone in every department rallied so that we could protect our patients and our staff from the unknown. Since then, with every successive wave of COVID-19, we have continued to learn and to find new ways to treat and prevent COVID. But these 2 years have taken its toll. Our people are tired and they're worn out. And some members of our communities have been waiting longer than they should for surgeries and diagnostic tests. And people's mental health has suffered. And so what we really need now is recovery, and to build our people back, our infrastructure back, and to find some sense of normalcy. Now, before I go on too long, I'm going to end with the warning that this pandemic isn't over, but we do feel like we are entering the recovery phase, and so. Absolutely, we will. We know we have to continue to be vigilant. I'm going to hand over to some of our leaders to share their insights and our plans for the future. But before that, I want to share some pretty impressive facts with you. So in 2 years of COVID, we admitted over almost 1,500 patients with COVID-19. We had 289 patients in our ICU. We treated over 4,000 patients with COVID-19 in our emergency department, and we completed almost 300,000 COVID tests. We had at one point in time as many as 84 of our almost 500 beds, so almost 1 in 4 of our beds were taken by COVID patients at the peak of the last wave. But there's some good news in that. Good news is we received over $2.7 million worth of donations from the community specific to the COVID response. That was amazing. And we supported 12 long-term care homes, a couple of them in a very big way, and some of them in smaller ways, like helping them with infection prevention and control, and helping them with PPE and other things. Virtual care really took off during the pandemic, and we've really gotten into that in a big way, both within the hospital and also our primary care partners. And that's a really good thing that's likely that is likely not going to go anywhere. So it's been a pretty incredible 2 years. It is unlike anything that I've ever encountered in my 36-year plus career in healthcare, and I honestly, I hope it's the only pandemic that I ever have to go through. But I would like to turn over to some of our speakers. We have some amazing people that are going to speak to you, and I'm going to do that right now. So Lindsay,
Okay.
do we have Barb?
We're going to go to John, I believe, right? Unless, yeah, okay, we'll go to.
Let's go.
All right, and we'll go back to Barb in a moment for pandemic reflections. And we will go to the master plan update.
Thanks very much,
John,
Lindsay.
Go ahead.
Thanks very much, Lindsay. Just waiting to be live. Perfect. Thanks very much. Thanks very much for that introduction, Arden. And a big thank you to all of our community for taking time from your evening to join us to talk a little bit about where we're at and also about our vision for a new Southlake and our master planning and advocacy work. Next slide, Lindsay. I think a lot of you are probably very familiar with Southlake and some of the exceptional care that we provide, but you may not know that Southlake is one of the largest hospitals in Ontario, with a budget which is approaching $500 million, 550 beds. We employ nearly 4,500 staff and physicians. So in the next couple of slides, I wanted to start to frame a little bit of the why or the need behind our master plan, which is really the ever-growing gap between the constraints or the limits of our existing facility and the evolving care that we need to provide to our patients, all of which in the context of this explosive growth of the communities that we serve. Our current physical plant is really challenged to meet both current demands and the new and evolving infection and prevention control practices, nor can it really support future growth. As a result, we often have the largest volume of hallway or unconventional beds in the central region. Much of our infrastructure dates back to the 60s and 70s, where buildings are either at the end of life or the system's infrastructure really requires a complete overhaul to be able to support the current standards of care. Over the past few years, we've had a number of infrastructure challenges, including a significant power outage, which really challenges our ability to continue to provide the quality care we aim to deliver. And maybe most poignantly, our master planning work really revealed that we would require about 89% more physical space just to simply right-size our current units to contemporary standards. And that's just to maintain our current bed count, not factoring in the significant bed increase required now and into the future. And despite all of the above, and the fact that we serve one of Ontario's fastest growing and fastest aging populations, Southlake has not had a significant acute care capital expansion since 2003. So in the next slide, I wanted to highlight some of the data that really underlines the need for a new Southlake. This slide really outlines some of the dramatic growth that's been experienced by the communities we serve over the past decade and a half. As you can see from the data, the overall growth of our core catchment communities has really significantly outpaced that of the province as a whole, with 30% versus 13% for the province. And our compound annual growth rate has outpaced the province by roughly double. Even our slower growing communities have outpaced the province. And when we look at the next slide, we can see it's even more striking how this growth is translated into acute activity for Southlake Regional Health Center. In terms of our bed count, we've gone from 360 to about 474, or a 31% increase, nearly doubled our emergency visits to almost 112,000. Our discharges and our patient days are up by about 50%, and our alternative level of care statistics are up a remarkable 500% with respect to patient days and our ALC rate. Even our inpatient surgeries are up considerably by 30%. And again, Southlake's main campus has had no significant acute care capital expansion since 2003, and the incredible amount of growth in service provision we've accommodated over the past 2 decades is really highlights the extent to which we've outgrown our current physical footprint. So we've talked a little bit about the past and a little bit about the present, and these next couple of slides look to our future growth in demand for services. This graph in particular outlines the expected 20-year growth in the need for inpatient services for the 76 subregions across Ontario. The data is assembled by a consulting group using an age-weighted methodology that really breaks down the population by age cohort, looks at historical healthcare utilization, and then it projects it forward based on what we see as the anticipated population growth for each group. As you can see, highlighted in red there, Northern York region sits among the very top regions in the province for this growth. And when we look at the next slide and zoom in on those subregions in the top tiers for inpatient growth, all of the other top regions either have a new hospital or an approved hospital expansion in development, with Northern York region sitting as an outlier, having not had a significant capital investment in acute care for almost 2 decades. So in summary, when we look at our past growth, our current utilization, and our future projected growth, the data or the information really does tell the story and underline that need for a new Southlake. With that, I'd like to talk a little bit about our master plan and some of our advocacy efforts. Our master planning exercise looked at all of this data, all of this projected growth and future demand for services, and then of course worked to align this data with some of our neighboring health facilities in Mackenzie and in Markham, Stouffville, and Royal Victoria to make sure that our data and our information was discrete and there wasn't any overlap or double counting of the growth. We reviewed and developed multiple optional solutions, of course, including a redevelopment of our existing site. And when we looked at this option, it really proved to be challenging through our analysis for a couple of reasons. First, the existing site is quite small and landlocked relative to the requirement for the bed base that we really need to build to. We really need to look at a site that's 60 to 100 acres where our existing campus is less than 20. Secondly, there were some technical challenges related to the floodplain, but maybe most importantly is, really the challenge that comes with trying to build the plane and fly the plane at the same time. The complexities of redeveloping a hospital while that hospital continues to operate will take considerably longer, create challenges for existing operations and staff, and ultimately drive a much greater cost than a new site or a greenfield solution. So if we go to the next slide, the preferred option really involves a new acute-focused facility built on a new site to current standards and sized appropriately for the number of beds that we need to serve our community. But we didn't simply want to reproduce or replicate the existing site. The preferred option envisions a new greenfield with this very acute focus while we reconfigure the existing campus for ambulatory and lower acuity services with a particular focus on our geriatric population. We'll look to relocate our alternative level of care population from the current remote sites back to the Davis Drive site so that they're closer to home. Work to consolidate ambulatory services which support the geriatric population to be able to create somewhat of a one-stop shop. As a core partner of our Ontario Health team, we'd be able to provide opportunities for smaller health partners in the community to have space on our campus, really providing, again, that one-stop shop that an Ontario Health Team hub can provide. I think we may be the first master plan to a submission to really contemplate the health team model as a key component of its submission, which is exciting and certainly forward-looking and garnering a bunch of enthusiasm so far. So if we look at the next slide, in addition to our efforts in developing our master plan, we've been working on multiple fronts to advocate and advocate for the endorsement of our plan. Our advocacy approach was really focused on trying to embed a common and a data-driven narrative at all levels of government, both politically, both on the political and bureaucratic fronts, but also amongst our community. Since submitting our master plan in 2020, we've met with a number of cabinet ministers and MPPs, and also discussed our plan with the Premier on a number of occasions. Our formal advocacy campaign was launched in the spring of 2021 to help rally support from our communities, and it included letters of support, media, and engagement with other key stakeholders, including our municipal councils. We've also held a series of community virtual town halls, which were co-hosted by the mayors of our municipalities. All again to the end of trying to embed that common narrative that the data really does speak to the need for a new Southlake. So in the next slide, lastly, we wanted to highlight some opportunities for you as a community to get involved and support. First, to help the community stay informed and engaged, we've established the website anewsouthlake.ca, where folks can go to get an overview of the need, the plan, and the process, and to receive updates on the plan and other community engagement opportunities. Secondly, nothing really resonates like a supportive correspondence from individual community members. So we'd encourage all of you to write to your local MPP and speak to the need for a new Southlake, particularly now, of course, as we approach the election. And finally, spread the word. It really takes a village, perhaps the better part of multiple regions, to build a hospital. So we encourage you to connect with your friends and with your neighbors so that you can all join the choir for a new Southlake. So with that, I think I'll pass it either over to Jen or back to Lindsay to share with Barb. Lindsay?
Thanks, John. Actually, I'm going to pass it back to Arden. Fortunately, we don't have Barb joining us tonight, so Arden will be speaking to her areas. So just a moment, and I will go back to those slides in just a second. Arden, in the meantime, you are live.
Unfortunately, this is one of the downsides to virtual, is that sometimes, depending on where you are tuning in from, your internet doesn't work. So we've got a little bit of an outage that's impacting one of our speakers. So I'm going to take that over. On behalf of Barb, Barb Steed is our Executive Vice President of Clinical Operations, and she's also the Regional Vice President of our Regional Cancer Program. And she and all of our senior team and all of our directors and managers and frontline staff have done yeoman's work in order to really deal with this. And I really want to call out as well our physicians who, some of whom were sleeves up and really had to over contribute, and other people who really didn't get to do some of the work that they are trained to do, for example, our surgeons. So I'm really happy that we are getting back to some sense of normalcy here. The pandemic really impacted clinical work across the hospital. And these categories really show you how. So certainly surgery and cardiac, we had government directives that were very strict that we needed to follow around reducing surgeries, and that really created a growing wait list. And the government did that for a good reason, and that is really, unfortunately, I don't think governments or anyone, none of us probably ever think that we are going to have the sort of ability to have this extra capacity just in case an emergency happens, like a pandemic. And healthcare is very expensive, and so how healthcare has been running in Canada and really probably everywhere for the last many years has been that we flex up and down based on capacity. But it does mean that you don't have a lot of extra when something like this happens. And so in a case like this, what had to happen was that, we had to redeploy staff from outpatient areas and from surgery so that we could look after more patients in the ICU, more in sicker patients, more patients in the medical areas that were sicker than they normally had been. In our outpatient area, again, we had reduced volumes. We had reduced volumes in diagnostics as well. So those are things like MRIs and CT scans. But we had a surge of testing in our laboratory, and we had a lot of work in our pharmacy around vaccine management. In our cancer area, we had screening backlogs. And so what we're seeing and what we're actually noticing across Canada and across North America is that we're starting to see advanced disease onset at time of diagnosis now, because people were reluctant, especially in the first waves, very reluctant to come into hospital for fear of catching COVID. And now, of course, now that they're coming in, they've got more advanced disease. We certainly had our medical areas, inpatient areas. We had a lot of challenges in there. We have a very old facility, so that means we have many multi-bed rooms, and in those multi-bed rooms, we needed to reduce some of the capacity in those to be able to have appropriate infection control with the number of COVID-19 patients we had. And I also want to do a shout out because, you know, our medical nurses were really had to step up to the plate and look after patients with respiratory compromise that they, you know, who were sicker than they had normally looked after. Were on higher levels of oxygen therapy than they were used to. And these are patients that ordinarily might have gone into the ICU and been looked after there. And I have no end of admiration for the way that our staff in COVID units really stepped up. In pediatrics and mental health, what we saw is a really big increase in demands for children living with eating disorders. And this is consistent in mental health. We saw an increase in mental health concerns that were raised on an outpatient basis. We know that for kids and for teenagers especially, not being able to follow their normal routines, going to school was very stressful for them. And so these all played into some of the issues we saw in hospital. At our assessment center, we tested, as I said in the earlier slide, almost 300,000 people. I mean, it's incredible how many tests we've done. And in our vaccine clinic, it was implemented, actually first implemented. So we implemented in December 2021 with our Ontario Health Team partners. But prior to that, Southlake ran the Ray Twinney vaccination center in the very early days when vaccination was first coming out, when they had just developed a vaccine in November of 2020. And so we now have a cough, cold, and flu clinic. This is we've got one in Georgina, we've got one locally, and we have those so that we can hopefully have people who have some kinds of symptoms that may be COVID, keep them out of emergency, go straight into one of these clinics where they know exactly what to look for and can stream people into the right types of services and hopefully keep them out of hospital. Next slide, please. So you can see that we had some big spikes, and every wave, those were the waves. So you can see the waves as they came. We thought we actually had a big wave. You'll see that it's just a little bump now. That first foray into COVID, which was the March, April, May of 2020, but that was really nothing compared to what we saw last winter. So in December and January of 2021, we had a very difficult time. We only had a very short reprieve, and then we were right back into it in April and May of last year. That was a very difficult wave. And then you can see just how difficult this last wave was. And in that wave, we saw the highest level of admissions that we had ever seen. Next slide. You can also see that in the ICU, interestingly, we had more total admissions in this last wave, but a bit of a lower impact on the ICU. Why was that, you say? Well, that's vaccination. So in the early wave, you can see that, in fact, the level in the ICU was quite high in proportion to the overall number of patients we had in the hospital, and that was because we had no vaccines. We still had no broad vaccines by January, February, and March, which is those early waves. of last year, the only people that were getting vaccinated at that point were people in long-term care facilities and healthcare workers. Once we started to really see a much more robust vaccination and a higher proportion of people vaccinated, that's why you see in January and February of this year that although we had the highest number of overall admits, we had a much lesser impact on the ICU. And in the emergency department as well, you'll see that we had the highest impact in this latest wave. But once again, what we saw is that we had a lot of people in the community with COVID, but proportionately fewer people with severe COVID. And that really tells us that vaccines did what they were supposed to do. So the highlights of our response. So, you know, I really wish Barb was here to talk about this because she was absolutely key in getting many of these things really up and running. And it really does take a village to keep these things going. But one of the things that happened is that we created a surge plan to be prepared. So every day a team of leaders met. They looked at the number of beds we had, how we staffed them, what kind of support services were there, what kind of PPE we had, whether we had any other supply chain challenges, any facility challenges. All those things were reviewed every single day and actually many times a day. Staff availability related to COVID was really difficult in the Omicron wave, and that's because the prevalence of Omicron in this last wave was so high in the community that so many staff of our own staff were down with COVID. Now, fortunately, none of them had to be hospitalized in this wave, and that's because they were all vaccinated. But they did need to stay off work, obviously, because we needed them to not be in a position where they may transmit the disease. And we also needed them to recover so that they had enough energy to be able to work. We had to do a lot of reassignment and redeployment of staff. And I just want to call out that, you know, the average person on the street who doesn't know a nurse or a physician may think that it's quite easy for you to just move from one area to another because it's still nursing or it's still being a physician. But the reality is that both nursing and medical care and respiratory therapy, a number of things are very highly specialized. And so when we need people to move from a specialized area to another specialized area, there's a lot of work involved with that. There's training and there's anxiety on the part of staff. Even if they're well qualified, it's still a change. And so we are very thankful to our staff for their flexibility in moving. Visiting, so there is no question that this pandemic has been extremely hard on patients and families. The inability to have your family members there with you when you are ill, especially if you are in a vulnerable state, if you are very elderly, if you have some cognitive issues, if you are having a baby, if you are at end of life, these are very, very difficult traumas to go through as a person and to not have your loved ones with you. And from an ethics point of view, this has been a very challenging thing for all hospitals to deal with. We have to balance that what we know is the benefit of having visitors in with the safety for all others in there, from other patients and staff, as well as everybody else who are in the hospital and trying to prevent outbreaks. And I know that certainly in long-term care they face this, but we still face this in hospital, and we have been relaxing our visitor policies, but we're doing so in a very graduated format because we want to be sure that that we don't inadvertently create outbreaks that will put us in a position where we'll once again have to ramp down visiting. And then the last thing that really affected us was supply chain shortages. And you know, those supply chain shortages came into effect because of, especially in Omicron, not because there was necessarily a shortage of goods, but sometimes the bottleneck might be that the people who transported the goods were all sick, or the people who worked in the factory that produced the goods were sick. And so somewhere in along the multiple parts of the supply chain, there were issues around, people who worked in warehouses or again in transportation. And so those things could created real challenges for us in getting the goods and service, the goods that we needed in some cases. So we had to be really flexible, and we had some amazing people who worked in our distribution department who helped us, source new different types of replacement goods to be able to make sure that this all worked. Next slide, Lynn. One of the things that has been very, very challenging, and also has been very, very, I think, worrisome for all of us and in leadership positions, and actually to a degree it makes us feel a little bit hopeless, is really trying to keep morale up during a time where the pandemic is so prolonged. It is one thing to have high morale when you have a very short and heightened response to an emergency. And in healthcare, we're often very geared to that. We're used to that adrenaline rush and trying to, just drop everything and respond. But you can only maintain that level of energy for so long. And after a while, this constant, when is this ever going to end, gets to you. And it certainly has gotten to our staff who have not had as many vacations as they needed, have not probably gotten to spend the type of time with their friends and family that they would have liked to sort of burn off some of that stress, and who have had to deal with things like homeschooling their children, dealing with, aging relatives who may not be feeling well, who may have COVID, etc. So we've tried to do as many things as we could to try and improve morale. We have something called Feel Good Fridays. We send out a number of recognition types of emails that we get from staff and from other patients. We try to keep people updated. We have regular town halls. We have a regular email that goes out to staff to give them all the latest information on what's happening with the pandemic. And we've tried to communicate with our communities as well as much as we can. I guess to sort of wrap up the whole staff morale thing, I would say that you in the community play a huge role. In the first wave, you did a ton for staff morale by donating food, by making other donations, by coming in and cheering, by painting beautiful stones and leaving them at our front doors. But those kinds of things, again, are hard to sustain, and those haven't really happened over the last year. And so what staff actually have to deal with a lot is sometimes some not very kind behavior. And we know, and they know, that everybody is very frustrated and that they have a lot of stress as well. But one of the things that we really ask people to be is to be kind to the people who work in our organization, because they don't set the policy. They come to work every day and they do their very, very best to look after you. And so even though it may be frustrating that you can't visit your friend or your family member as much as you would like, we really, really ask you to be kind. This is a little bit of moving forward. So this is what we're focusing on this year. The really key one that we're focusing on is addressing care backlogs. So we have we had some pretty big wait lists for some surgeries prior to the pandemic, and those have gotten longer. We are really focusing on those. We are up to close to 90% normal surgery and procedural volumes now, and we'll continue to really focus on that over the next year. We're going to really be addressing our people. We know that we can't do any of that. We can't address care backlogs, and we can't address any of these things without without our people, and it has been hard for our people. It's been hard for our leaders, and we really want to focus on trying to make their worlds better if possible. Patients coming to hospital are more acutely ill, and we have to be prepared for that, which means just having the right type of bed complement, making sure that we have the ICU staffing and the critical care staffing that we need. We know that pediatrics and mental health and eating disorders is a very big issue province-wide, and that is actually an international problem that has been documented. And so we've added some capacity there, and we will continue to make sure that we do our best within the constraints that we have to be able to deal with that in our communities we serve. And supply chain issues are not going away anytime soon. Fortunately, the CP strike was averted. But given the situation in the Ukraine, we know that there are still issues and going to be continuing issues around supply chain just due to world events, even if we manage to get through the pandemic completely. Next slide. Okay, so we've gone to that. So now we're going to skip forward, I think, and we're going to go to Jennifer. And Jennifer's going to talk to us about our foundation's response and a little bit about what the foundation needs from you.
Thanks, Arden. I can hear an echo of myself. I wanted to approach from a slightly different perspective, and that is from the perspective of the foundation as a catalyst for the outpouring of community support. And Arden talked about the $2.7 million that was raised in COVID relief. That was really important in the early days for a lot of equipment that we didn't know whether it would be covered by government or not. Life-saving equipment like ventilators, portable X-ray machines, medical field tents, negatively pressured, that became assessment centers. So all kinds of things that our physicians and staff depended on. You answered the call when they were competing with the rest of the world for those types of, for those critical needs, and we were able to secure those early on. At the same time, Arden spoke about the ongoing difficulties of morale in an extended pandemic. And she talked about the Honk for Your Healthcare Workers parades. There were lawn sign campaigns early on started by New Roads and Neil Brothers to show that we were Southlake proud. But some of the things that have really resonated with physicians and staff who have continued throughout the 2 years to take care of our friends, our families, our relatives, and our communities are the other things that community has stepped up to donate or pay for or provide, just to say we care about you. Countless Tim's Days, months of free coffee, donuts, food that have continued throughout the last wave, and support for wellness initiatives, things as simple as carts going from unit to unit with treats to help boost the spirits of our relentless physicians and staff who have, been dealing with this pandemic. And one of the really touching stories that I heard when I first joined the foundation last year was how individuals in our community created specialty hats and headbands that had buttons on them that people could hook their masks onto to save their ears when they were getting sores from wearing masks for endless periods of time. Your donations also paid for internet and free technology so that isolated patients could be connected by staff with their loved ones. The community was incredibly, incredibly supportive. And in the words of one of my colleagues who's been with the foundation for a significant period of time, while the community's always been supportive, the outpouring of support was incredible. It really is, and I'll talk about this in a minute, a symbiotic relationship or partnership between community and their hospital. I think I'd like to share with you an inspiring quote of gratitude from a Dr. Nazia Panjwani, who was a physician in one of our COVID-19 units, which I really think speaks to that relationship. Southlake always talks about being by your side and providing leading edge care. I think this speaks to how the community is by Southlake's side. So Dr. Panjwani says, to all the donors supporting us during this time, we see you and we appreciate you. Your donations are important because they help take care of the necessities so we can focus on caring for patients. We're in this together and we all have a part to play. COVID-19 has sparked a sense of community, charity, and teamwork, and is exactly what we need to overcome this crisis. In healthcare, we know that you are only as strong as your team. Your donations keep us strong, healthy, and hopeful. Our hearts are full, and behind our masks, we are smiling. What stays with me is that by your side is a mutual promise. Southlake makes that promise to our communities, and our communities make that promise to Southlake. Our Southlake community extends beyond these virtual walls. It's every physician, every staff member, every patient, and every donor, every volunteer, and every member of every community that we serve. And so as I talk about, John talked about the future, and he talked about the need to expand our footprint by at least 89% to meet today's modern standards of care. I'll talk a little bit about some of our current critical needs, because as you may or may not know, building a new hospital takes time. And in the interim, we have immediate issues that we need to address. When I'm speaking with individuals in the community, some people know this and some people don't, but I talked about the symbiotic relationship. Healthcare needs aren't solely met by our tax dollars. Healthcare is a partnership between government, hospital, and their community. Southlake absolutely relies upon the generous investment of our communities in order to be able to deliver that leading edge care and deliver it close to home and to be by your side. We simply can't do it without you. Next slide, please, Lindsay. One of the areas of greatest need, and I think Arden spoke to this as well, was the need to transform what was happening in mental health care at Southlake. We have absolutely incredible clinicians, physicians, and staff, but again, the overcrowding leads to conditions that are very, very difficult. And while mental health needs were increasing before COVID, we know that during COVID, this became the other silent pandemic. And Arden talked a little bit about this particularly affecting youth and also particularly affecting adult women. And so delivering this care becomes increasingly difficult in spaces that are overcrowded, that see individuals in hallways. And our incredible team faces unacceptable barriers every day that they have to navigate. Small, cramped spaces, lack of natural life, lack of privacy, all the things that are absolutely essential to begin the optimal healing journey and recovery. Next slide, please. So in order to overcome those obstacles, Southlake set about transforming its space in order to meet today's modern standards of care and best practices from admission through treatment. We've built the Emergent Mental Health Assessment Unit, which sees us get individuals in crisis out of the emergency department more quickly. Stays of 4 to 5 days have been reduced to moving them within 24 hours to spaces that give them privacy, natural light, allow for the opportunity to treat patient and family in a supportive therapeutic setting. We've set about expanding, adding 12 beds to our inpatient mental health unit. We see 17 people a day in our emergency room, 33,000 people a year, about over 1,100 of them stay with us for an average of 2 to 2.5 weeks. It's critical that we have this expanded space so we can serve another 400 individuals a year and help them on the road to recovery. We'll also revitalize our outdoor patio space, and we know that fresh air and natural light and being able to get outside and move is integral to beginning any kind of journey to mental wellness. Next slide, please. So we started last year in the pandemic, in the fall, we started our Better Begins Today mental health campaign. And I want to say thank you for all your support to date to help us address the critical needs in our community. You've helped us raise 87% of our $7.5 million goal, which is fantastic. And we're actually just under $1 million. We have about 998,000 to go to complete all these essential projects that will help us better deliver the kind of care that we're capable of and to be better members of our community more quickly. If you would consider going to southlake.ca/better to learn more, we appreciate it, and certainly the individuals that come to us and depend upon us for help will appreciate it as well. Next slide, please. And one thing I want to bring to your attention, because it's good for all of us to get outside now that it's spring and we can spend time together outdoors and doing healthy activities that are good for our mental and physical well-being as well. I would love to invite you to return in person to the Nature's Emporium Run for Southlake, which will be on April 24th this year. Arden and I are actually co-MCs, so we would love to see you come out and join us. If running, walking with a large group of individuals is not your thing, you can still do whatever you like, whatever physical activity inspires you. You can do that in the month of April, and you can benefit your hospital and put advanced equipment and tools needed by our clinicians right into their hands. If you care to visit runforsouthlake.ca, you can learn everything you need to learn in order to register or to support a team. We look forward to seeing you. It's going to be a great day, and hopefully this wonderful weather will hold up. And it's, like I said, it's good for everybody's well-being. So really just want to say thank you for your ongoing support. Again, it's a symbiotic relationship, and Southlake simply can't deliver leading edge care and be by your side close to home without your support and partnership. So thank you so much, and thank you for giving us your time this evening.
Thank you, Jen. So we are going to move to questions and answers. Okay. Oh, Arden has already answered some of these in the chat.
I was busily answering.
Okay, did you want to mention them live as well?
Sure, I think we can do that. I think there's been some questions around, you know, the vaccine and transmission, and you know, there certainly was some controversy about all of the hospitals in Ontario, almost all of them, I think it was about 98%, developed mandatory vaccination policies. And we did so because the reality is that while no medication or preventative type of policy can ever give you 100%, you know, certainty in terms of whether you're going to catch something or not, healthcare, people who work in healthcare are behooved to do everything that they can do to try and keep other people safe. And we know that when we go into healthcare. And so that's why all of our people prior to the pandemic who came on to work at Southlake were required to have the full set of childhood vaccinations, and they had their teeters taken to make sure, I know because I had mine done myself 5 years ago when I came on, to make sure that they are not at risk for passing other types of diseases like measles or chickenpox or hepatitis. COVID is no different, and so we decided that it made sense to do that, and so that's why we've adopted a mandatory policy. No vaccine is 100% at preventing transmission. What we know about the COVID vaccine, and it is absolutely proven, is that not only does it reduce transmission, it doesn't eliminate transmission, but it does reduce transmission. But what it really does is it reduces the severity of illness. And that's really, really important, because that takes COVID from being something that could be a death sentence to having the flu. And that's important. You know, I got COVID. Some of you know that in wave 1, I call it COVID classic. So the very first wave of COVID, I got COVID. And that's why I call it COVID classic, like Coke classic. And during that time, there was no vaccine. It was very, very scary to get that. And I'm a very healthy person. But I was laid out in bed for a week. And so that was scary. I think that, you know, as we develop vaccines and as we get more complacent with the fact that if you have a vaccine, you don't get very severe illness, I think we start to forget that that's the thing that actually helped us manage this. That's why the latest waves we've been able to ride. So that's why we did it. That's why we will continue to have a vaccine mandate. And fortunately at Southlake, we had less than double digits in terms of the overall number of people that did not comply with our policy and ended up leaving the organization. And when you think that we have almost 4,000 people, that's a pretty small number.
Thank you. So while you did answer the other questions in the chat, I just want to note that if we put the video on YouTube, these questions and answers will not show up there.
Oh,
so
sure.
were there any other that you wanted to highlight, or did you want me to read them out?
Why don't you read them out and I'll just review them? Yeah.
Sure. Okay, so with the political election coming up in June, what type of tangible support are you looking for from the provincial government? What should we be looking at for in election campaigns? I am always wary that political promises have not always translated into timely action in the past. I believe this is referring to the master plan.
Yes. So, well, I mean, it's actually a couple of things. So, you know, we've actually worked, you know, pretty collaboratively with government over this period of time. And the Ontario Hospital Association has also been a great venue for advocacy for all of us, because we've been pretty busy with the response. So we don't always have a chance to just be on the horn to government officials and our local MPPs, although we have been doing that a fair bit as well. But what we really need going forward is we need to have the operating room to be able to recover. That means that we're going to have to hire and train more staff. Because, you know, like all places, we've had some retirements, we've had some people who've said, wow, this is really tough and it may not be for me, but we also have additional demand and we have to respond to that demand, and we can't respond to that demand with the same number of staff we had before the demand increased. So we have to have operating dollars to be able to deal with that, to deal with inflation. Inflation is running at about 5% right now, especially with the supply chain challenges. And so there's a lot of issues that we need operating dollars for. The other thing, of course, is capital dollars. And, you know, at Southlake, one of the things that sometimes prevents us from being as efficient as we would like to be is the fact that we have patients in nooks and crannies. And when you have patients in nooks and crannies, because you're so full, it means that you can't necessarily staff it the same way that you would staff a larger unit where you have a larger group of people looking after the patients. There's just efficiencies in that. And so, you know, we really, really need a new hospital. Our hospital is dated, it is disjointed. It was good for maybe 2003, but we're now almost 20 years past that in terms of the types of growth that we've had in our community. John outlined a lot of that in his presentation, but what we really need is we need a major planning grant to be able to get to the next stage of development. And that next stage of development will involve things like looking at site selection, developing a more refined design for the new site, and getting a sense of what the operating budget for that new site would need to be.
Okay, speaking of a new site, somebody did ask how long it will take to build a new hospital. So maybe I'll put John up to elaborate on that. He did answer it in the chat, but there's some info here. So yeah, how long does it take to build a new hospital? John?
Yeah, thanks, Denise. So as I answered in the chat, it takes roughly 8 to 10 years, and that's really due to the multiple phases that we need to move through. Obviously, a hospital is a very significant investment, and it's something that is trying to serve a very dynamic industry in healthcare. So getting it right is really important, not just for the current state, but also projecting for the future. So moving through the planning, the design, the procurement, the construction, and then, as Arden mentioned, the operations, it takes roughly about 8 to 10 years to get to the opening of the first patient.
Okay, thank you. That looks like it's it for master plan. So I am going to go back to Arden just to answer a couple more here, and we have about 4 minutes left. So Arden, how are staff doing right now? I know that COVID-19 has been tough on everyone, frontline hospital staff, especially not only nurses and physicians, but all staff from CEO to environmental service technicians.
It's been a really tiring 2 years for people. People at the front line have really struggled because they've been right there seeing the impact of COVID on patients and on families. People in leadership positions have been stressed because they've been trying to support those people at the front line. They've been trying to make sure there's enough staff. They've been trying to make sure there's enough supplies. People in support positions who aren't clinical, but who work in places like distribution or information technology or finance. Everybody, it really does take a village to run a hospital. It's a very complicated operation, and it takes everyone to be able to really give it a full court press. And so it's been very stressful for people. And then, as these things are happening in your workplace, just imagine that you're also struggling with all of the pandemic related issues that everybody else is struggling with. So you're trying to, teach your kids at home, you're trying to deal with your elderly parents, you're trying to figure out, how you can visit your grandma in long-term care. You're dealing with somebody who may be sick with COVID. So there's all of these things that are going on for people, and it's been very, very challenging. We want to be able to give our people a rest. And we also know that in order to give them a rest, we have to have enough people that they can have a rest while still ramping up services to be able to deal with our all of the issues and challenges in our community, because healthcare never stops. You can't just say, okay, time out, nobody come to emergency because people need a rest. People keep coming because they're sick, and that's our job, is to look after them. And so that's the challenge, I think, that people have. And, I think for those of us in senior leadership positions, I think, we feel a different type of stress. Our stress is all around absorbing some of the stress that our people have, trying to help them, and sometimes running out of tools to be able to help them because the pandemic continues regardless. And so I think that's been challenging. My sincere hope is that this truly is this last wave was our last big wave, and that if we have a few blips, that they will just be blips, and they will be things that we will be able to cope with without reducing other services again and getting into lockdowns and all of that. That's very hard on people. And so I really do hope that we're in a recovery phase now.
Okay, thank you. And just one more question. What are some things that Southlake is doing to help address the surgical backlog and mental health needs of the community, and what can the province do to help?
So we do have a ramp up plan, and that plan was sort of structured after the wave before Omicron, and we had started to sort of ramp that up. The government had dedicated at that time some additional funding to be able to fund some of that ramp up. I'm hopeful that in the 22-23 provincial budget, there will be some more funding for that kind of recovery, that ramp up in surgery. We know that our surgeons are very keen, and they will definitely put in the extra time to do extra surgeries. It's really just around having the number of operating room nurses, the respiratory technicians, the post-anesthetic recovery room nurses, those kinds of folks, the ICU nurses. So we need to have those folks in place. And we're busy and fortunately do have some government funding around a number of programs to get more critical care trained, staff in place, etc. But you don't produce those folks overnight. It takes a long time to train people and to get them in place. And so that's what we're doing right now. We have expanded to a smallish number, a couple of extra beds in eating disorders, but that's going to be something that I think is going to be an ongoing issue for a couple of years within the province. And I'm happy to say that pediatric hospitals and community hospitals like ours that have pediatrics, those folks are all working together. We have some excellent leaders physician leaders in pediatrics who are all working very well as a network to be able to deal with some of those things. But there is never enough, and there was a big wait list in that even before the pandemic, and that has just gotten worse. Mental health is a big focus for us at Southlake, both as a hospital, but also as a part of our Ontario Health Team, and we're working with our Ontario Health Team partners in the community to work in a much more integrated fashion when it comes to mental health care. We, for example, are one of 4 Ontario Health Teams in the province to be part of a pilot where we're trying to figure out how we can trial bundled funding for schizophrenia patients. So that's just an example of where in the past we had always just said there are standards for schizophrenia, we're a hospital, this is what we do. But we're now thinking beyond our borders and saying, how can we work with our partners in the community to try to make a schizophrenia patient's journey better across the whole continuum. And by working together, we can do that. So those are just a few examples. There's many, many more out there, but we're keen to employ whatever we can to be able to recover.
Thank you. That's it, and we are at time.
So I'll just close out. I want to thank the people who attended. This will be, I think, shown on YouTube, so hopefully we'll get lots more attendees who will take a little view on YouTube to be able to see what's going on with their hospital. We plan on having more town halls with our communities, hopefully in person, and hopefully I'm going to be hopeful here and predict that in the next year or two we're going to be talking to you about a new development and getting out into the community and showing you what the possibilities are around a new Southlake. And we appreciate our community's support. It is critical, as Jennifer has mentioned. Although we're very proud of our public health care system in Canada, it is not without its challenges, and without the support of our communities, we could not make things happen. So thank you very much for attending, and thank you as always for your support.